go. I want to thank everyone for joining us right on time today on this Good Thursday. My name is Selena Wilson, and I'm the Vice President of Organizational Effectiveness at the East Oakland Youth Development Center. Very honored to be here with my co-moderator, Milan.
Happy Women's History Month.
Thank you. Thank you sincerely.
And I am excited to co-moderate this program as well with the dynamic, amazing, and if you don't know who Selena Wilson is, get to know her. My name is Milan Valentin, and I serve as the Executive Director of the African American Community Service Agency, which is located in Santa Clara County. And we are excited to be here today, right, Selena?
Tremendously excited and truly honored to be here in service of our community today.
Definitely. We would like to invite all of you to get you some water, sit back, get your pen pad. If you need to get on your Twitter to get those fingers moving. Welcome to the second COVID-19 regional town hall meeting with several guests from throughout the Bay Area. And we do have today with us Dr. Nadine Burke Harris. Give her some love in the room for joining us, as definitely we are here to get informed and empowered because we need to save more lives.
Absolutely. We have a tremendous agenda before us today. We recognize that Zoom fatigue is real, but we promise to make this an engaging and interactive experience for you. So we will be opening up in our plenary session with some keynotes from Andre Chapman, who's been leading the work, the really critical work of COVID-19 Black, and we'll give him a more formal introduction in a moment. We are also, again, going to be receiving a keynote from our Surgeon General, Dr. Nadine Burke Harris, followed by some county-specific breakouts. We want to ensure that in addition to a state view, we really have the opportunity to break down what's happening in our direct communities. We're joined by a host of physicians, experts, community-based organizational leaders, leaders across the sectors in all of our counties here in the Bay Area to ensure that you are getting the information that you need to protect yourselves, your families, to make informed decisions on how we can safely continue to navigate this pandemic that has truly been devastating to our community.
Yes, and we hope you all feel welcomed into the room and into the space. Please definitely use the chat function to shout out your county or your city where you are located. Please make sure that you also submit your questions so that we can make sure that we get you timely and important information. And also make sure that you reach out to your public health officials when you find out who those folks are. We also want to remind everyone, since we know we're virtual, is to make sure that you pay attention to the time, because we are here to also keep us on time. So we will be reminding all of our speakers and all of our guests that will be with us today about the time to keep us on track.
Before we continue with the rest of the formal agenda, we do want to take some time in the tradition of our ancestors to acknowledge the divine creator, the benevolent ancestors, all those impacted by COVID-19, including the 73,236 Black lives lost to COVID-19 as of March 2nd. We want to acknowledge the loss, but also the resilience and all of the solidarity and self-determination that it has taken collectively for us to make it through. So let's take a moment and acknowledge in the tradition of your faith, whether that be Amen, Ashe, and so it is. Now I will turn it over to my co-moderator, Milan.
And recognizing the ancestors and how they walk with us and guide us, we can chant, I am Black and I am proud. But we can also stand in solidarity with our brothers and sisters from the Asian American Pacific Islander community. We understand in the Black community, the African ancestry community, what hate looks like. And so when you see us, know that we are with you, call on us to stand with you, to march with you, and to fight against what we all know it is, white supremacy. So there's no secret there, and what we know, what are the issues, and so we stand together with our brothers and sisters. Now, without further ado, I would like to introduce someone that I look up to. I know he represents a different color when it comes to fraternity world, but he is a brother that has been a mentor and someone that I've looked up to. I would like to introduce to all of you Andre Chapman, founder of the COVID-19 Black Initiative. Andre Chapman.
Thank you, Brother Milan, and thank you, Sister Selena. And it's great to see you, Dr. Nadine. This is going to be an amazing experience, amazing opportunity. You know, we have over 1,000 people registered, and we still see the numbers coming in. And so, you know, unfortunately, we can't wait for everybody to get to the room to eat at the table, because we got to get started. We have some amazing speakers, as Milan and Selena said earlier, so that we want to go ahead and get started. I want to go ahead and pull up my video, the presentation.
Our COVID-19 Black Health Initiative provides the path for Black leaders to engage in guiding our community towards holistic health amidst this global pandemic. Let's listen as 3 philanthropic leaders share their truth and inspiration for our community.
Hello, I'm Nicole Taylor, the President and CEO of the Silicon Valley Community Foundation.
My name is Fred Blackwell, and I'm the CEO of the San Francisco Foundation.
My name is Maurice Jones. I am the President and CEO of LISC.
I'm here today to talk to you about the importance of Black initiatives around COVID-19, specifically COVID-19 Black.
It is really important to support Black-specific responses to COVID-19.
It is critically important for Black communities in our region to understand the truth, the facts.
As we have seen, Black and brown people in this country and in the Bay Area have been disproportionately impacted both by the very direct health-oriented consequences associated with the pandemic, but also have been negatively impacted by the economic impacts associated with sheltering in place and social distancing.
Nationwide, 33% of COVID-related cases are in the Black community, yet we make up only 13% of the American population. And right here in Silicon Valley, we make up just under 3% of the population, yet 8% of COVID-related deaths. There are pre-existing conditions in our communities due to systemic racism, the lack of ongoing public health care, the lack of ongoing health care. We have high rates of diabetes, high rates of high blood pressure and other cardiac issues. We have high rates of asthma.
If we're disproportionately impacted by these issues, we also need to have strategies that are tailored specifically to Black communities in order to address those who have been most impacted.
We need trusted sources of information. It is really hard to trust media and communications that are going on in our country.
As a member of the Black community, I know that I'm part of a larger story, a story that includes people who before me had to navigate slavery, had to navigate Jim Crow, had to navigate separate but equal, had to navigate the not having the right to vote without being intimidated. That's my story. I'm a part of that story. And it's my job to make sure that I do my part to keep that story going in a positive direction.
Black leaders in particular need to be a part of this effort because part of being a part of the solution and helping our community to stay healthy and thrive during this moment is having the community educated on what the issues are and connected to the folks who are developing solutions.
There's nothing that we can't do. I know that if we come together, that we can actually also help the community produce miracles. And that's what it's about.
So it's important that leaders step up, that Black leaders step up as trusted individuals in our community to speak the truth and let folks know, yes, we can get it. And when we get it, it can be deadly.
Black leaders absolutely have to be involved in this communications effort because we need our communities to be informed.
Continue to fight the racial gaps when it comes to health and wealth and opportunity, so that we can help the community continue to make progress.
We need to keep safe, and we need to make sure that members of the Black community understand what's at risk, who's at risk. Our lives depend on it.
We invite other leaders to join us in this fight to keep our community safe and healthy. For additional information, visit www.covid19black.org.
Okay, that was a video of the work that we're doing on the ground. So I'm going to back up a little bit and talk a little bit about this initiative so people understand where this came from. Next slide, please. So a little bit about who Unity Care is. So for 27 years, Unity Care has served and advocated on behalf of thousands of foster youth and families across Northern California. We provide housing in 9 Bay Area and Northern California counties. We have a long history of fighting against systemic racism that is pervasive within our formal systems. This project was just an extension of what we already do. Because we have a history of standing in the gap for our communities, when I launched this project back in a year ago, COVID-19 Black was our opportunity to raise public awareness surrounding the disparate health and wellness outcomes impacting the African ancestry community. Next slide, please. So a little bit about how this came about. Nearly a year ago, this project came through my professional and personal experiences as we saw many of our young folks at Unity Care really challenged with understanding the impact of the virus and understanding the impact of how this was going to sit on our community. Personally, I experienced this in my own family. My mom at that time jumped on an airplane to go to New Jersey at the height of when New Jersey was shutting down their airports. And she said, listen, I'm prayed up, the blood of Jesus, nothing's gonna stop her from going. So we know in our community, there's a generation of our community where faith guides our decisions. So I had to move very quickly to take action because it reminded me, if you think back to what happened with the AIDS epidemic, many of you may recall when AIDS first came out, it was really considered a gay white man disease. That did impact the African-American community. And it wasn't until Magic Johnson caught it that it changed our community's perception, but unfortunately it didn't change our trajectory. As of today, more than 40% of new AIDS cases are African-Americans, and we're not talking about it. So in partnership with the Black Leadership Kitchen Cabinet, we engage our community, we develop a communications platform, a strategy, so our community could hear directly from images that were culturally appropriate through the lens of our communities, imagery that lift them up, information that was relevant to our own, by our own storytellers and by trusted resources. We partnered with Silicon Valley Community Foundation, gave us our initial seed funding, and we expanded the project across the Bay Area. We went live on June 30th last year with our first regional town hall event and unveiled our website, as well as it kicked off a communication platform. So the video you just saw was one of many videos that we launched that was from leaders, folks in the community that can speak to us, hear stories from us, hear about our journey so that we can get engaged in this project. I would encourage everyone to go to the website. Next slide, please. I would really encourage everyone to go to the website and spend some time understanding and learning about the information that's on the website. It starts off with the crises. Across the top, it talks about our disparities. And I would say our disparities is one of our favorite sections because it goes deep into the centuries of the racial inequalities and discrimination that's sowed in today's health crises. It highlights what I call the backpacks of trauma within each life domain. So it looks deeply into the structural racism and the barriers that are embedded inside our health, our housing, our education, our employment, our legal, and our well-being. The story sections, you hear the voices of our courageous community members. They share their narratives, their lived experience of battling COVID. Also the challenge of having buried their loved ones. Just last month, my former college roommate had to bury both his parents. So when we think about the impact that this is having in our community, this website provides a great place to go and hear stories from our community. To take action is about doing something about it. Go on the offense. How do we strengthen our communities? How do we strengthen yourself? How do you eat healthy? How do you exercise? Hear from doctors. And then the resource section has more than 300 Black-led organizations across the Bay Area because we know many of us live in the Bay Area, you can't drive into one community and find us. So this is a resource guide that allows you to find African-American-led organizations that can help support you in whatever the challenges that you may be facing. Next slide, please. And then I want to be mindful of this slide because, you know, we all have this sense of relief, and I want to, you know, pause for a minute. We have this sense of relief because we're opening back up. And so there's this sense that things are getting better, and they are. But look at the data. If you just pause for a minute and look at the data over the last 3 months. And as Selena said earlier, since we started this initiative, we've lost 73,236 African Americans. Just look at the last 3 months. From December to January's reporting period, 5,560 Black folks had died. From January 2nd to February 2nd, 7,627 Black folks have died. And then this last reporting period from February 2nd to March 2nd, more than 10,029 of us have died. So when you put that in context, we're opening back up, but at the same time, our numbers are increasing around the number of us that have passed away. So it's very important that you protect yourselves, our loved ones. And tonight is an opportunity to not just learn, but ask questions, take control of the information so that you can make the best decision for yourself and your loved ones. Thank you.
Thank you, Andre. I want to make sure that we give you your roses and your appreciation for founding and having the vision to even bring this forward. So everyone give Brother Chapman some love in the chat for putting the energy into the universe to make sure that this happened for our community to get informed and be empowered. Make sure that you also find the hashtag, and the hashtag is hashtag COVID-19 Black. I'm going to drop it in the chat for you. We want to make sure that when you tag us on social media, that you drop that hashtag so then we can see all of your 120 characters, some of the photos that you may take from your screen, since we know you are all using technology to connect in. Now, moving right along, I have the humble honor and pleasure of introducing our speaker. What an impressive bio. I have 3 nieces, and when I was telling them this morning about what Uncle was going to do today, I mentioned to them about one of our Black Girl Magic. And they were like, who is she? Tell us more. And of course, there was so much to tell them. Hopefully they're on right now watching and observing who you are, because I grew up in Baby Hunters Point, and so some of your work, I'm sure, impacted my life. So this Her Story maker, Dr. Nadine Burke Harris, is an award-winning physician, researcher, and advocate, dedicated to changing the way our society responds to childhood trauma. She was appointed as California's first Surgeon General by Governor Gavin Newsom in January of 2019, and has been an integral part of the state's pandemic response. Not only that, but she is also newly appointed chair of First Five of California, which I have the humble honor of operating our First Five Family Resource Center in Santa Clara County. Dr. Harris, beyond all of that, of her other titles, is mother, wife, and sister friend to many. It's a quote that she said, "I'm very lucky to be doing what is an expression of my soul." Without further ado, everyone, Dr. Nadine Burke Harris.
Thank you so much, Milan. Thank you to Andre. Thank you to COVID-19 Black. I'm so grateful for all of you for having me here this evening. And I'm happy to provide an update from the state, from the standpoint of the state, and hopefully answer a few questions before you jump into the county breakouts. So I want to start by first acknowledging that while we all have similar challenges as a result of the pandemic, we know that some groups are disproportionately affected. And that's why an event like this is so incredibly important, to recognize and lift up our communities, right? And lift up all of you who are advocating on behalf of the most vulnerable. So I wanted to thank Unity Care, Roots Clinic, Minority Business Consortium, Black Leadership Kitchen Cabinet, African American Community Service Agency, and Silicon Valley Community Foundation for hosting this event and bringing us all together so that we can have these important conversations. I'll start by just giving a broad view of how we're doing overall in the state. We know that more than 15 million vaccines have been administered, and more than 5.5 million Californians are completely vaccinated. And when we think back to even just a year ago, right, thinking about the future and thinking about when is this going to end, to think that the fact that now, right, between December of 2020 and today, we have vaccinated 15 million Californians. That's extraordinary. The state receives about 1.8 million doses per week, but that is going to continue to increase, especially as we get into April and May. I think our projection for next week is that we'll hopefully get 2 million doses. And you know, one of the things that's challenging is that one of the things that's important is that we, of course, prioritize vaccinating our seniors first. So now we have almost 2/3 of those who are 65 and over who have received at least one dose, right? So that's fantastic. And it's something that we're happy and excited about. But one of the challenges is that we know that as we vaccinate our seniors first, as we vaccinate our healthcare professionals first, that Black and brown folks are disproportionately underrepresented among those groups. So we have a lot of work to do to move forward in improving our vaccination among our Black and brown communities. And many of you may have heard that the governor made an announcement today that we're getting ready to open up eligibility.
The objective was update on the San Mateo County vaccines. I think you all will be doing that when you do your presentations. Because I want to not talk a lot.
You can go ahead and mute your mic.
To say what you need to say.
Hello.
Okay, thank you. Yes. So on April 1st, we are moving to opening up eligibility for those 50 and over, and opening up eligibility for on April 15th to all Californians 16 and older. And as we think about opening up eligibility, the important question is, how do we maintain equity as we move that forward? And if you, next slide, please. And so when California, and this is one thing that I am so proud to be your Surgeon General, because being in my role, one of the things that I am most proud of is making sure that California has a strong plan for vaccine equity. So what we've done is we've had a 5-point plan that includes, number one, allocating more doses to our communities that are most impacted. We use something called the Healthy Places Index that measures essentially socioeconomic status. And what we see is that the lowest socioeconomic quartile, even though they're 25% of the population, they experience almost 40% of COVID cases and deaths. So what we are going to start doing, because that lowest quartile has also only received about 17% of vaccine, right? And that's a consequence of us starting with healthcare workers and seniors. And so what we're doing is we are now targeting vaccine proportion to disease burden. That means 40% of vaccine is going to our lowest quartile in the Healthy Places Index. But it's not enough to just target the vaccine. We have to make sure that folks have trusted places where they can go to get vaccinated. So having a provider network that's in the communities that are most vulnerable is critically important. I was just on a call today where we looked at the hours that vaccination sites are open. And what did we see? In the highest quartile, they have more hours on evenings and weekends than what is in the lowest quartile, right? That's got to change. And that's something that we're actually putting into our agreements with providers, is that they have to meet our equity metrics. We know that we have to have trusted partners, community partners like yourselves, that can do this outreach. And that is why COVID-19 Black is so important, because we have to talk to our communities in language and in ways that we know that we can see ourselves and trust the message and the messenger. Of course, we need data and analytics and to know whether we're doing a good job, and then public education so that we can deal with the misinformation and disinformation, right, that disproportionately harms our communities as well. So California has actually set intentional targets around vaccination of our lowest HPI quartile that is connected to reopening. So once we got to 2 million doses among our lowest HPI quartile, that meant we got to open up our tier restrictions a little bit. When we get to 4 million, we'll be able to open a little bit more. So we're really tying equity to reopening so that we can have an equitable reopening. Next slide, please. I'm really pleased to have the role of chairing the Community Vaccine Advisory Committee. And that is a group that is tasked with helping to oversee California's vaccine distribution. And we're incredibly fortunate, just over a year into this pandemic, to have 3 vaccines that are safe, that are highly effective, and that are free. And so that is one thing that we're extremely pleased about. Everyone should feel confident in these 3 vaccines. And I say this with a little extra confidence because I got my shot earlier this month. I got the Johnson & Johnson vaccine. And, I felt a little achy breaky the day afterwards, but of course I'm a total science nerd. And so when I got like the fever and chills, I was like, yes, it's my immune system working. And I think I'm the only person who was super excited about having side effects because I could feel my immune reaction. But to be honest, I'll tell you, the experience that I had when I found out that I was getting vaccinated was, it was just overcome with joy. And the first thing on my mind was, I can't wait to hug my mom. I can't wait to hug my mom. I haven't hugged my mom since the start of the pandemic. And she also was vaccinated with the Johnson & Johnson vaccine. And I think that's what we're all about. We want to make sure that our parents are here and our brothers and sisters and our cousins and our aunties are here so that we can hug them again when this is all over. But as excited as I was to get my vaccine, I know that my journey is different from others. There are lots of people who don't spend all day, eyeballs deep in all the data and the science and, reviewing the data from the FDA and the CDC. So we know that for some of us, our friends and family members may have questions, may have concerns. And that's why it's so important for us to be able to put out trusted information. And if you, next slide, please. Oh, that's me. Next slide, please. And so one of the things that we did in California is we launched the community immunity campaign, really that's about culturally sensitive messages to prioritize raising awareness among our communities. It's called immunity, but the word unity is capitalized, right, for emphasis, to really make sure that our communities are receiving messages, and our educational campaign is actually targeted to our most vulnerable communities so that folks can understand and get the message, to reach out if they have questions, to talk to a trusted provider, to talk to someone who they trust to get information about the vaccine. And so with that, I wanna just thank Unity Care. I wanna let you all know that when we get these messages out, when we have this information that we have safe and effective vaccines, you know, that the final question, of course, is how do Californians get the vaccine? How do I get it? And, you know, the state has tried to simplify and make a simple, straightforward, easy way. We have the My Turn system. It's myturn.ca.gov. So anyone can go on, put their information in and find out if they're eligible. That won't be an issue after April 15th. Everyone will be eligible. And then get an appointment. And listen, we recognize that right now we are constrained by supply. So for a lot of us, that experience of trying to get an appointment, you got to be patient and persistent. That's what I will say. But as we're ramping up our supply, that's going to be a thing of the past. So as we are moving in this time of much more abundant supply, one of the things that's critically important to me is that we don't wait, that our community does not get left behind, and we don't see a widening of disparities. And with that, I will be happy to take some questions.
Thank you so much, Dr. Burke Harris. We are so appreciative for your expertise as well as your, vulnerability in sharing your own personal experience with the vaccine. With that said, one of our first questions is about, as you're looking at the data, as you're speaking with your fellow experts in the field, what can you share about the efficacy or what we know about the efficacy of all three vaccines as it relates to the various strains of the virus that continue to be developed?
Yeah, that's a great question. So so we know that all three vaccines, Pfizer, Moderna, and Johnson & Johnson, have their efficacy data was 100% efficacy in preventing death and hospitalization. Now, when we look at the overall efficacy of preventing severe disease for Pfizer and Moderna, we've heard that 95%. For Johnson & Johnson, we've heard 85% in preventing severe disease, which is what we're concerned about. And one of the things that I think is really important is Pfizer and Moderna were tested a little earlier than the Johnson & Johnson was. And so Johnson & Johnson was tested in South Africa, Brazil, and also in the United States. At the time that it was tested in South Africa, 95% of the circulating strains in South Africa was the South Africa variant. It's the one that we're concerned about. So when we look at that 85% efficacy from severe disease, that includes efficacy against that South Africa variant. Now, in terms of for all three, we don't know efficacy against the Brazil variant or the UK variant, but we do have data that Johnson & Johnson is the one where we have data around efficacy against the South Africa variant.
Thank you so much for that thorough answer and context and insight. I'm going to turn it over to my co-moderator, Milan, for our next question.
Our second question, what would you recommend for those in the Black and Brown community who may be hesitant to get the vaccine?
So I would recommend talk to a trusted provider. So if you have a doctor or a healthcare provider, or you have someone in your family who is a nurse, or but definitely reach out and talk to a trusted provider and take the time to have your questions answered, right? Because we deserve to have our questions answered.
Awesome. I recognize that many of us, including myself, were introduced to you through your groundbreaking work around trauma and its impact on children and families. So I'm curious, are there any particular tips, guidance, advice that you have for parents and families who are struggling with the mental health issues, the chronic stress, the emotional duress that the pandemic in many ways has intensified?
For sure. So a couple of things. One of the weird silver linings of the pandemic is that mental health care, like accessing a therapist, has become much more accessible. There are so many folks who are doing phone therapy, teletherapy, app therapy, text therapy, right? So that has blown up. And I think that is something that is incredibly important. And I hope that it's something that won't go away. The other piece is that what the science and the data tells us about how stress and adversity affects our brains and our bodies and affects our risk of mental health concerns is that there are two key pieces. One is the dose of adversity. So the more stress and adversity you have, the greater the risk you experience. But the other is buffering, nurturing connections. And with someone you trust, who's someone who cares about you, someone who helps you feel understood. And this pandemic just was like the ultimate, was like pouring gas on the fire, right? Because it increased our stress and it took us away from all the people who would buffer our stress.
On my phone.
And so that's what I would recommend, is just staying connected to the people who you love and you trust, whether it's picking up a phone call or going out. Like one thing that I do, I go and do walk in the park with my girlfriends. We just mask up and we walk and talk. That's like a thing. And you get a little exercise on and you just talk through all your problems.
Another question.
Really appreciate that practical advice. Milan.
Yeah. That's very important to hear from you to the community. One of the questions that was posed in the chat is that I've heard mixed messages about getting the vaccine if you have tested positive for the antibodies. Can you please speak to this and clarify it?
If you've tested positive for the antibodies, is that referring to if you have had COVID?
Yes.
So that's a great question. So one of the early on, there was a question of, for example, folks within 90 days of exposure, right? If they, the CDC said, if you've had COVID within 90 days before it's your time to get a vaccine, you can, postpone it and get it later. Short answer is, I would recommend for everyone who has not been vaccinated to get vaccinated. So even if you've had COVID, I would say still it's worth it to get vaccinated. And one of the interesting things that we're seeing is that for some folks who have had COVID and who may be having persistent symptoms or some of the long COVID symptoms, when they get vaccinated, for a certain percentage, they see some improvement as well. So vaccination is warranted whether you've had COVID or not.
I had to look to make sure I wasn't still on mute. I'm still getting used to this virtual experience. And by you sharing that, because oftentimes here at the African American Community Service Agency, we run into our community from generation to generation. And there's a lot of young people who are, questioning whether or not they should get vaccinated. Or why should I get vaccinated? I can still catch the coronavirus. Can you speak to why, so that some younger people who are on here will understand, how can you get vaccinated and still catch coronavirus?
Yeah, so So first of all, when we talk about why our community needs to get vaccinated, we just heard from Andre about the data and the statistics about our disproportionate death rate among African Americans. And I will say, and I'll just throw this in as an aside, part of my research on stress and how stress and trauma and adversity affects our health, one of the things that it does is that for those who have experienced higher doses of adversity, it can affect your immune system. And so when I look at the data in California and I say, wait, Blacks and Californians in California have a lower case rate of COVID, but a higher death rate. Yeah, there's pre-existing conditions and there's lots of reasons for that, but there's also more going on here that is concerning. So the big reason of why to get why to get vaccinated is so that you don't die, or so that you don't get really, really, really sick. Because there are people who are getting COVID and having long-term neurologic symptoms, right? Or having long-term cardiovascular symptoms, or long-term lung problems. And it's not just senior citizens that have really difficult outcomes as a result of COVID. And we just, when you can prevent it with a vaccine, it's worth doing.